We have made some headway, but overall, we don't stand anywhere in the world. See, if you see the countries where organ donation is being done in a good way and is in practice for last 20 years, the organ donation rate is around 20, 25, 35 per million population. If you look at Spain, the highest organ donation rate is around 35 per million population. And we are at 0.34 per million population as of now. So our organ donation rate, I would say, is one of the lowest in the world, and we need to do lots more. See, the first law was passed in 1994, the Transplantation Act. So that gave us the definition about brain death and how to diagnose brain death, etc., etc. But the law was a bit restrictive. It never led to any organ donation activity. The new law, which has come in 2014, which is the Transplantation of Human Organs and Tissues Rules of 2014. Now, that is going to make a big difference. The prominent things in the new rules are that earlier brain death could be diagnosed only in hospitals which are approved for organ transplantation. But now, brain death can be diagnosed in any hospital which has an ICU. So, even in smaller hospitals, nursing homes, you can diagnose brain death. Organs could be retrieved only in centers which were transplanting. But now we have non-organ transplant retrieval centers. So, smaller hospitals not transplanting, we can retrieve organs. It has now become mandatory for the treating teams to ask the families about organ donation whenever there is a brain death. So, earlier there was an option, now it has been made mandatory. So, that's a very good thing. Transplant coordinators, they were a rarity in our country, but now the new rules talk about every hospital having at least one or preferably two transplant coordinators. We used to have a very tough time in getting organs in patients with head injury because they were medical legal cases and we needed police clearance, post-mortem. That procedure has also been simplified with the new rules. So, all in all, the new rules are very much more user friendly and they are going to make a big difference in our organ transplants. See, DBD stands for donation after brain death, and that is the way usually organs are retrieved in the world. So, in brain death, what happens is the injury is to the brain so that the brain dies, but the heart continues to beat. So, the beating heart is central to the concept of organ donation because it is sending blood to all the vital organs, and the vital organs are working for a few hours or days till the heart also stops. So, brain death is death. Brain death is not reversible, but in brain death, the heart is still beating for a few hours. That is the concept of organ donation. Now, the question is, once the heart has stopped, can we take the organs? How much time do we have? Do the organs work? What are the ethical and other issues involved? What does the law say on this? So, these are the questions which come in. So, in the Western countries, we have a concept of withdrawal of life support. If somebody has an illness from which he is not expected to recover, he is not maintained endlessly on ventilators in ICUs. The treating team assesses the problem, they talk to the family, and if everyone feels right, the care is withdrawn. When that happens, the option of organ donation is given to the family. So, if the ventilatory support is withdrawn, the heart stops after say 1 hour, 2 hours, and once the heart has stopped, they wait for 5 minutes. If it doesn't restart, then the organs are taken. So, this is the concept of donation after circulatory death. In our country, right now what we are promoting is that if we have a patient who has brain death, and while the paperwork is going on, while all the formalities are going on, the second test for brain death is not yet over and the heart stops, I think we should be ready, and in that situation we should not allow that organs to go waste. So, what is happening is there are times when the family says yes to donation, but we are not able to take organs in brain death. So, this is a newer concept in India definitely, but it's been practiced for about 20 years in the Western countries, and about 10 to 30% of all organs which are transplanted in the world are taken from DCD, but majority of organs are still DBD. All patients who will ultimately become organ donors are the ones who are in ICU, who have been treated to the best of ability of all the doctors and still are not going to survive. So, basically these patients are in the hands of the ICU doctors. So, my plea to all the doctors who work in ICUs and related fields is that whenever there is a brain death, we should talk to the family about it. We should tell them about organ donation. We should disclose that the patient has brain death early when the organs are still functioning well. And very importantly, once there is brain death, there is an hour to hour deterioration of all the functions of the body. The heart function goes down, the liver function goes down, the kidney function goes down. So, we have something called a donor maintenance protocol. So, once a brain death is diagnosed and the family is still thinking about organ donation, unless we start those protocols, which are very simple medications to maintain the blood pressure, we give some corticosteroids just to reduce the inflammation. So, if we start those medications, the organs can be preserved for much longer and the risk to the recipients is much less. So, we must diagnose brain death, we should disclose brain death, we should discuss brain death, and we should maintain patients once they are brain dead. There is a very set protocol and the order is very clear that unless there is brain death, we do not talk to the family about organ donation. The initial talk about every patient is about saving lives. It's all about saving lives. But once we've tried our best and not succeeding, and then when we have proven that the patient is brain dead, that is the time the family is approached for organ donation. What we have to follow is what we call the dead donor rule. You can take an organ only from a person who is dead, already dead. And you should never do any kind of procedure which will hasten the process of death. So, whenever we are talking of organ donation in a setting of cadaveric or disease donation, the dead donor rule has to be followed. We cannot do any intervention during a patient's life which might cause death, and organ retrieval should also not cause death. So, patient has to be dead first and then we talk of organ donation.